During any given day, you or your fellow officers may come into contact with me or someone else with diabetes, and we may need your help. Diabetes is a chronic illness that can have serious consequences if left untreated. No matter where you encounter a person with diabetes, in public or while they're in custody, it's important that you understand what diabetes is and how diabetes can affect a person who has it.
Just after coming on duty one morning, we witnessed a driver going several miles over the speed limit and began to follow the vehicle. The driver then pulled over and stopped in an illegal parking space. The driver departed the vehicle, leaving a passenger in the front seat. When we approached the car, we noted that the passenger was obviously uncomfortable. She was perspiring and seemed very nervous as we came to speak to her.
Diabetes is a condition where there's either insufficient amounts of insulin or the insulin in the body doesn't work well. Insulin is a hormone which is important for us to be able to use carbohydrates to supply the body with the fuels it needs. Diabetes is very common. There are 18.2 million people in the United States who have diabetes, and perhaps a third of those don't even know they have it. Diabetes requires a careful balancing of food, activity, and for many people either insulin or oral medications to keep blood glucose levels from becoming too high. It's absolutely critical that medication not be interrupted, even for a short period of time. However, sometimes medication combined with other factors can result in blood glucose or sugar levels that are too low. Both high and low blood glucose levels can cause a person with diabetes to become ill and create a medical emergency. When a person with diabetes who takes insulin or certain pills hasn't eaten enough, or for other reasons has too much insulin in their body, they can experience what's commonly called an insulin reaction, low blood sugar, or hypoglycemia.
Police officers may encounter a person with a diabetes emergency while on patrol, in an arrest situation, or when an individual is in custody. By having a basic understanding of the disease and the best course of action to take in such a situation, we can protect the safety of officers and citizens alike.
Good morning, ma'am. Noticed that your vehicle was parked in the school zone and I wanted to see if everything was okay.
Yeah. No. Yeah, everything's okay. My friend's gonna be back in a minute. She just went to go and get something for me.
Okay, well, ma'am, I don't know where she went, but unfortunately you're parked in a school zone and you can't stay here. Ma'am, what's your friend's name? And do you know where she went?
Her name's Mary Johnson. She just went to the store across the street.
Okay, ma'am, what's your name?
My name? I'm just sitting here. I'm not even doing anything.
Ma'am, please, can I have your name? There's no need to get upset.
I'm not upset. I was just sitting here waiting for my friend, and I don't feel very well. You're just sitting here harassing me now.
As we spoke with her some more, it seemed obvious that she was either under the influence of something or having a medical problem.
As the person with diabetes experiences rapidly lowering blood sugar, several things can happen. Becoming unreasonable, uncooperative, confused, or denying anything is wrong is common, and it's important to quickly determine if this kind of behavior is due to a hypoglycemic episode. The signs that a person is experiencing hypoglycemia can include shakiness, dizziness, sweating, hunger, headache, pale skin color, sudden moodiness or behavior changes, such as crying for no apparent reason, aggressive or hostile behavior, clumsy or jerky movements, difficulty paying attention, tingling sensations around the mouth, inability to swallow, loss of consciousness, or seizure.
Although I had to consider it as a possibility, it seemed as though this was not a typical case of a person under the influence, and there was no signs in the card to suggest alcohol or drugs. In this case, we proceeded to rule that out and look further into the possibility that this individual was experiencing a medical situation. Ma'am, I just needed to ask you this so that we can help you. Now, do you have any medical problems or issues that we can help you with?
No,
do you have any
I'm
medical...
minding my own business. And then come up and start asking me questions.
When a person's blood sugar continues to fall, disorientation and confusion can increase. If the person is having trouble thinking clearly when answering questions, a little more time should be taken to figure out what is wrong before taking any action. Asking questions more than once, or in a different way, may allow time for the person to realize what is wrong.